speaking, is there's the vascular risk factors, which I'll go through shortly. So things like blood pressure, diabetes, cholesterol. But obviously, somebody who's 18, most patients don't have them. Maybe you have insulin-dependent diabetes, you're born with it, but most people don't. Okay, so we're looking for other things. So there are things such as a hole in the heart. So a quarter of the normal population, so 1 in 4 people have a hole in the heart. Okay, but half of young stroke patients have a hole in the heart. Problem with that hole in the heart is a clot can form in the blood anyway, okay, but it then goes into the heart, goes through that hole and up to the brain and blocks a vessel in the brain, and that's how you get a stroke, through the hole in the heart. Prevention wise is what we do now is look for that hole in the heart. Once we find it, we send the patient to our near hospital, Royal Brompton, where they close that hole, essentially. Okay, and he will remain on blood thinners for life, irrespective. There are other causes, so things like inflammatory disorders, what we call vasculitis, where you get inflammation of vessels in young people, clotting disorders. Interestingly, when we went back through the history with his parents, his dad said to me, actually, I've got a gene for a clotting disorder gene. He's never had clots of any sort, but his dad, so the patient's granddad, has had DVTs, so clots in the legs and clots elsewhere. So we do think that's of relevance. Okay, so we're now looking for that gene if he's got that. Okay, so we just look that much deeper. Sometimes we put loop recorders, so a little device under the skin, and that looks for the irregular heart rhythm. So there are different things that we look for. It takes a bit of time, but in the background, he's getting treated anyway to reduce the risk of a further stroke. Stress is a difficult one, okay, because you do find that a lot of people who have a stroke may have been stressed at the time. But at the same time, I see a lot of people in my clinic who come in with stroke symptoms but are actually mimics. They're stressed, they're anxious, but they're having a migraine. Or they have anxiety-related symptoms that are coming on as if they are stroke symptoms, focal symptoms. So stress can be a contributor, but realistically the contributing part of it is probably it can raise your blood pressure. Okay? So if you have high blood pressure, be conscious of being stressed. Okay? Unfortunately, as Giles was saying, he said he had high blood pressure, and it may have spiked at the night. We don't know. Okay? But generally speaking, you need to keep an eye on your blood pressure, take your medications, make sure it's well maintained, and I think we all need to reduce our stress somehow. Anyway, yeah, for life. So a quarter of the normal population have a hole in the heart. It does not do anything. It just doesn't close at birth. Okay? There is a small number of people who have a stroke. Okay? And they're young. And the cause of their stroke will be that hole in the heart that they have. For example, I don't scan every patient. So I will not scan somebody who's 60 with high blood pressure, diabetes and high cholesterol for a hole in the heart, because I'm not going to do anything about it, because they may have one. 1 in 4 people have one, but I don't think that's the cause of their stroke. So generally, it's if a young person has a stroke, a hole in the heart in half of those patients will be the cause. Yeah, but I definitely don't scan everybody. I'll only scan the right patient. And I think it's a postcode lottery, not necessarily based on your hospital. I think it's based on your clinician. If I'm completely honest, there's doctors that I wouldn't send my family to, 100%. You ask me which ones to send your family to, because I think it's really important. It's a real shame. Okay, we do our best. Everybody is in a really difficult situation. The NHS is under a lot of burden, and we're doing our best. Like even me doing this, my mum and my husband will tell you that I overwork, but I'm still here doing this because this is what makes me happy, Again, delays, we commonly have also, so Charing Cross is a regional centre, so we take patients who may have had a clot or a bleed in other centres. So, for example, we take patients from Northwood Park, we take patients from Reading, we take patients from Stevenage, lots of places around so it's and we do our best. Part of the problem we have noticed also is delays with the ambulance service bringing the patients over, because they're again understaffed, underfunded. Okay, so we're there waiting in Charing Cross for like 2 hours for a patient, to the point that we're like, when is this patient? Because we're thinking time is precious, you know, every second counts. But again, a big problem for government to sort out, I think, to try and to do our best. We will do our absolutely big problem for patients, and I think all I can do, and hopefully my colleagues will do, is try and educate and try and get people to do their best. You know, yeah, he's 18, and interestingly, this young man, apparently his parents said that he did have some heart tests because he's going to be going for Team GB, but actually, what do they do at that level? I'm not sure they look for a hole in the heart. What they do is probably a simple echocardiogram or an ECG. An echocardiogram will see the structure of the heart and the valves, wouldn't necessarily show you a hole in the heart. Well, I'm privileged enough to Giles mentioned the Chelsea and Westminster Foundation, who do a lot of work for my patients. So it's something that I'll take back and see if we can at least, if we can get it into Chelsea, maybe we can move it else to other parts of the football. And correct. So absolutely, but it's a different kind of hole. It's a different. So that hole in the heart, essentially, they're a blue baby because they're not getting enough oxygen. So if they don't fix that, they wouldn't survive. Okay. This type of hole in the heart doesn't really do anything. What it does is just form a mechanism that, just in case, if unfortunately you're the person where a clot forms and comes up, it goes through that hole. And it's that part where it goes through that hole that goes up to the brain that causes a stroke. Very, very, very good question. So, if you have sudden onset focal neurological symptoms, personally, I wouldn't advise you to take aspirin. The reason being, you could have a bleed. So we're talking focal neurological symptoms. As a stroke is a sudden change, and it's focal, so it's not global. So it tends to be either arm, leg, on one side, and it's a neurological deficit from the brain giving you those symptoms. Yeah? So that's what a stroke is. And yes, aspirin in general is okay because 85% of strokes are a clot. Yeah? But those 15% might not be. Yeah? So I would say just call 999. Because if I'm completely honest, aspirin 300 milligrams or aspirin 75 milligrams is not going to move that clot if there's a clot. Okay? That is what we use later on. Yeah? So I think just call 999. So which one is very bad? I don't think there's an answer to that, which one is very bad. It depends on the patient. So I've had patients who've had a very tiny stroke, so an ischemic stroke that looks very small on a scan, but they've got a really big deficit. They're very weak down the right side, and to them, that's disabling. Okay, I've had patients who have had scans that look like that, but actually have only got a bit of weakness in their hand. Yeah, so it depends on the patient. It also depends on their level of function. So, for example, if you're like this 18-year-old, rowing, running, high cognitive function, compared to somebody who might be in a nursing home who's talking to other people, so losing the speech in that lady or man in the nursing home who uses speech as their main, essentially, enjoyment, is disabling for them, whilst this young man, losing his arm and leg, has actually lost the rest of his life. She knew someone who's got sickle cell. So sickle cell anemia, we know it's relatively prevalent in the Afro-Caribbean society. So sickle cell is a risk factor for stroke. It's a risk factor for clots in the brain because your blood, it has essentially the actual red cells are sickled, so they look like that. Okay, so if you have a high number of sickled blood cells, they can block a vessel. If you imagine a lumen of a vessel is very nice and clean, and something comes in and it can't block it. So that's kind of the mechanism as to why sickle cell can cause stroke. Okay, but we also have, I think you mentioned that they had a lot of pain. Yeah, so sickle patients have bone crises commonly. They have pain, it can be in their chest or the bones, it can be on the